The visit is the foundational and most important component of our hospice's care experience. Therefore, it merits great consideration as we want to make each visit as good as it can be. There can be great variation in the quality of visits among individual clinicians, as well as among different hospices. Therefore, our hospice does not take the visit experience for granted and has put a great deal of thought into the creation of our visit structure. Now, you may initially think that this structure may impede on your clinical practice. However, you'll find that it will help you do a better job and help to ensure that important things, as well as small things other hospices may not have considered in the care experience, are not overlooked. For example, the structure is really only 30% prescriptive. The remaining 70% is based on your professional judgment and expertise. The visit structure will especially help you when you are tired or have had a taxing day. One of the main differences in our visit design is that you view yourself as a teacher, because that is what we are. Rather than view ourselves as, quote, providers of care, we view ourselves as teachers. Though we certainly provide care, a huge aspect of our work is teaching and being a trusted guide through the experience we are most familiar with. So think of yourself as a teacher, equipping caregivers to be confident in the care they are providing. Often this means demonstrating how things should be done. Many times clinicians feel that if they are not doing something, they're not doing their job, and this can lead to an unnecessary dependency upon the clinician as well as anxiety issues stemming from panic and lack of caregiver confidence when hospice team members are not present. This is why teaching is so important. A few other key points of the visit structure are the tone of the visit. Calm and compassionate, always. Manage expectations. Anything less than the patient or caregiver expectation results in disappointment. So try not to indicate or give the impression you can do something when you can't, from visit times to outcomes from your visit. And lastly, you carry an atmosphere wherever you go. When you enter a patient's home or space, you impact the environment. So when we make a visit, make sure you are projecting positive energy. This energy perhaps has more to do with the creation of a great care experience than what we say or maybe even do. So be conscious of your energy before you enter a patient's space. Make it positive. Our visit structure is one of the things that makes our hospice unique. Now here's an example of a visit structure. Let's make great visits. Phase 1. Pre-visit. Park in a place that is considerate of the family. For example, don't block the driveway, or if the driveway is pristine and your vehicle leaks fluids, park along the street. Review the notes from the last person to enter the home. The last person to visit from our hospice usually has the most up-to-date knowledge, and the patient and family need to know that we are communicating as a team. Breathe. Center yourself. Try to get into a peaceful and relaxed state, as this energy and spirit will be communicated on an energetic level to the patient and family. Think about now, and try to put out of your mind anything that would draw your attention away from the visit at hand. I am a teacher. See yourself as a master teacher guiding people through an experience that you are most familiar with. Teaching is the primary thing we do at our hospice. Take in everything you need so that confidence is not destroyed or diminished by repeated trips to your vehicle. Make sure your vehicle is neat. If by chance the patient or family members are able to see the inside of your vehicle, you want them to see it as organized and neat. This sends a message that if they are neat and organized in areas that are normally out of the public eye or behind the scenes, imagine how well the organization is operated and the quality of its people. This builds confidence. Be aware of your body language and appearance. Look sharp, well-dressed, and awake. A sharp image conveys confidence. Phase 2. Listening and Expectation Management. Announce your arrival and lift the atmosphere. "Hi, it's great to see you again," with a tone of positivity. Again, you are lifting the atmosphere with your presence energetically. Take a position that is comfortable for the person you are interacting with. Lean in to demonstrate genuine interest and compassion. Eye level is best if possible. Inquiry question. How is Dad today? What is your biggest concern? Listen, listen, and listen. Listen as a kind, experienced, and thoughtful teacher. This is a great time to sanitize your hands as long as it does not disrupt your ability to listen. Observe. Are you exhausting patients to where they cannot hear anymore? Based on what you hear, tell the patient or family member what you are planning to do, carefully managing their expectations. Here is what I'm going to try to do. This is an ongoing review of the goals of care. Remember, you are teaching when appropriate. You may want to recap what you've heard to make sure you understood them correctly, similar to a person that takes your order, only with extreme kindness and compassion. Phase 3. Professional Judgment. It's good to let the caregiver and patient see that you are using the visit structure template to help ensure and build confidence that important things are not overlooked or missed. People like to know there is a process. Use professional judgment to address what you are capable of addressing, as communicated previously. If you are unable to satisfactorily fulfill an expectation, inform the patient or caregiver about your attempt and the best course based on what you know. "I don't know, but I will find out and get back with you" is a good, honest, and the only answer when you don't know. Teach rather than do, if possible. This empowers the caregiver and leads to a more satisfactory experience as it lessens unnecessary clinician dependency and suffering from anxiety issues. Use the hospice menu to teach and manage expectations if appropriate. Use diagnosis guides to help manage expectations regarding the specific issues pertaining to the diagnosis. You don't want caregivers to be alarmed by changes or unprepared for the expected illness progression. Phase 4. Documentation. Review the medication tracking log. Review the caregiver documentation journal. Refer to the hospice companion if you have questions regarding documenting a situation. Check the patient's stock of medications and supplies. Does the patient have enough to last till at least the next week or until the next visit? Let the patient see your computer. Document, explaining the use of your computer, especially with your first few visits. I'm going to write some of my notes in my computer so we can coordinate our care. These help us so much. This builds confidence with the patient and caregiver. They like to know that the hospice is organized. It is important that documentation is done during the visit while the details of your visit are fresh in your mind. We all know how busy life can be, and it's difficult to remember things later on, especially if you're tired. Document at the time of your visit. We use an electronic medical chart to document your needs and concerns so you can have confidence that all team members will have your information. So even if you call us in the middle of the night, you don't have to retell your story over and over. We know and can focus on the concern. Phase 5. Build confidence. Recap what you have done. As a teacher, explain what you have done as well as what you didn't or couldn't do. Great teachers always review. Question: do you have any questions or concerns? We want you to be as comfortable and confident as possible. Listen, listen, listen. Boost assurance and confidence. I've checked your medications and supply stock, and you have everything you need. I've watched what you're doing, and you're doing a great job. In fact, I can't think of anything else you could be doing for your dad. If there are areas a caregiver could improve, you're doing a great job. To make it even better, do X and Y. Educate to reduce anxiety issues. This and this will happen. Teach about how to contact the hospice first if there are unforeseen changes or any caregiver anxiety. This helps to reduce emergency room and on-call visits, resulting in a better patient-family experience. When speaking about hospice, always refer specifically to our hospice, never just hospice. Educate caregivers and patients that not all hospices are the same. We have a very intentional system of ensuring care so that important things as well as small things are not overlooked. We are creating an experience. Phase 6. Post-visit. Communicate with other team members if needed while the specifics of your visit are fresh in your mind. Order medications or supplies immediately if needed. Sync your computer according to current standards. No-nos. Never give out your personal cell phone or contact information. Never give the impression to anyone that we are too busy to take patients. A hospice can give decades of great service, and this message will stick in people's minds for years. There is always room at the inn. No words and phrases. Continuous care. Instead, use crisis care so we do not create an expectation we cannot fulfill. After hours or on call. Instead, just tell the caregiver and patient that they can always call. We are a 24/7 hospice. Our visits appeal to the feelings of patients and family members. We want people to feel good. This basic concept drives our care experience. The hospice visit is the patient's experience and the family's memory.